Hi, this is Dr. Dan Ritchie from Miracles Fitness, and today I'm in sunny San Diego. It's a little bit windy as well. I'm here with Rick Kaselj, who is an injury expert. Rick, you want to tell them just a little bit about yourself?
Yeah, so what I specialize, I'm an injury expert, so what that means is I help people overcome injury and pain with exercise, and that's pretty much what my passion is, and I run a very active blog where there's all kinds of information and videos on that subject, and it's called Exercises for Injuries.
Cool. Well, Rick agreed to give us just a couple of minutes, and we're going to talk a little bit about knee pain. So I know knee pain is a common issue that a lot of clients have. So Rick, just tell our viewers just a little bit, especially about like cartilage and meniscus damage, and after surgery, or even if a client decides to not have surgery, how they can manage that pain.
So I mean, how I end up looking at those conditions, so cartilage, you know, meniscus, and if you end up getting like a replacement or resurfacing, those are all like internal knee joint injuries. So they all kind of roughly fall into the same category. So the number one thing to do is to do everything you can to help that the internal part of the knee work. And what ends up happening is people will stop moving that joint. Yeah. And what ends up happening with that lack of movement, it's one of those double-edged swords. Movement ends up leading to pain, but then lack of movement ends up leading to more pain. So it's important to try to work on that movement as much as you can, and understanding that there's two types of movements when it comes to the knee. You know, there's movement when you're standing, and there's movement when you're not standing. So, you know, weight bearing and unweight bearing, and trying to get that knee moving in an unweighted situation is what I try to get people to do. And getting them to move that knee, to, you know, if it's uncomfortable, they move through that uncomfortableness. I'm not looking for sharp screaming pain, but it might be a little uncomfortable when it comes to that movement side of things, and that's okay. And I want them to go to that point of pain, because what ends up happening with time is that end point of pain it'll get smaller, and you'll get more and more range of motion. And then when you get that more of that pain-free range of motion, you can start doing more and more of that rehab side of things, and that more and more movement decreases your pain.
Okay. So would you say, because a common complaint I hear is, okay, I had my knee replaced, I've gone through physical therapy, 6 months later, I'm still having pain. Would you say there is a solution for those people?
Yeah, I think there is a solution. And other things that I would end up looking at is, I mean, having them take away unnecessary stresses to the knee.
Okay.
So meaning, you know, are you excessively standing, or are you putting your knee into stressful positions like sitting for too long, or gardening in the backyard? Like, I mean, there's ways of modifying it where you put less stress on the knee, and putting your knee in that less stressful position will keep it less painful, which ends up being, you know, a good thing. Other things that I suggest people to do is, like, look, you know, your knee is, you know, one of the, and they say the largest joint in the body, but one big thing is hydration ends up affecting it a lot. When it's dehydrated and not taking enough water in, it'll end up becoming more painful. So one simple thing is looking at your hydration. And another thing is looking at your inflammation when it relates to that joint, because inflammation will slow down or prevent healing. And that inflammation can be a result of like the foods that you end up eating. And a very simple thing is, like, you know, a lot of times the processed foods we eat lead to inflammation and inflaming areas that are injured and painful within us.
Yeah. That sounds like a whole other conversation for another day, the whole food aspect.
It is.
Well, thanks very much, Rick, for doing this. I know that you have a fantastic product to fix your knee pain.
Yeah.
So if people want to get more information on that, where would they go for that?
Yeah, so the Fix My Knee Pain product, there'll probably be a link down below that Dan will put. And what it is it helps people overcome their knee pain. And just like I was saying, that, you know, there is a variety of categories when it comes to knee pain. And, you know, that internal knee pain is like that meniscus and cartilage and knee replacement. And I kind of give you like a 3-phase program that you can follow that ends up helping you overcome your knee pain.
Well, thanks very much, Rick. Sorry about all the trucks going by here in downtown San Diego. But check that link again below and check back often on our YouTube page here.
Thank you.